Well, good morning, everyone. My name is Jo Rich. I'm the Foundation Director at Westfields Hospital, and my co-facilitator, Lisa Rulo. Would you like to introduce yourself as well?
Yes, hello everyone, good morning. I'm Lisa Relo, the Foundation Director over at Amory Hospital and Clinic.
We have a few more people joining us, but to be conscientious of time, I think we'll get this started. But first, if you would please send your questions to our speakers using the Q&A tool at the top of your screen, and we will address as many as possible at the end of the session. Please do not ask any personal medical questions. And the session is being recorded, and the link will be sent to you after the session. So thank you for being here. All right, so HealthPartners is a nonprofit organization with a mission of improving health and well-being in partnership with its members, patients, and community. As an integrated system of care and coverage, HealthPartners operates hospitals and clinics, health plans, and a research and education institute. We serve more than 1.3 million patients in Minnesota and Wisconsin. By working together as a system, we share resources, expertise, and innovation to advance health for all.
I'm very excited that we have Marna Canterbury and Dr. Brian Palmer here today to present. And so I'd like to take just a moment to introduce our presenters today. Dr. Brian Palmer is Medical Director for Behavioral Health at HealthPartners Health Plan. In this role, he leads mental health and addiction strategy for our nonprofit, mission-driven health plan and its 1.7 million members. He is a graduate of Mayo Clinic School of Medicine and completed his psychiatric residency at Massachusetts General Hospital and Harvard Medical School. Prior to coming to HealthPartners, he served as vice chair for education at Mayo Clinic's Department of Psychiatry and Psychology and as vice president for mental health and addiction at Allina Health. Dr. Palmer is the author of 40 peer-reviewed publications and an edited book. Welcome, Dr. Palmer, and also Marna Canterbury, our Senior Director of Community Health and Engagement, brings decades of experience in community health improvement, nonprofit leadership, building community partnerships to her position as Vice President of Community Health and Partnership for HealthPartners. In this role, Marna provides senior leadership for HealthPartners community assessments, partnerships, and strategies, including programs like Make It Okay. Marna received her bachelor's degree in nutrition and biology from Concordia College in Moorhead, Minnesota, and completed her training as a registered dietitian at the University of Iowa. She received her master's in community health from Minnesota State University, Mankato. Marna provides community leadership through multiple nonprofit boards and coalitions with an emphasis on food insecurity. This collaborative work has led to numerous published articles on the intersection between social factors, food, and health. Welcome, Marna. Welcome, Dr. Palmer. And now I believe, Dr. Palmer, you will be presenting. Looking forward to hearing your presentations today.
Thanks so much. Really appreciate the introduction, and it's great to be here with everybody on a topic that is important to all of us. And I will open, and Marna and I are going to go back and forth a little bit talking about some of the mental health impacts in the community and how HealthPartners is trying to meet the moment and respond. We will have plenty of time for questions, so really encourage you to add questions to the chat, and we can keep this as engaging as possible. And it is called Coffee and Chat, so I do have my coffee to make sure that I'm participating fully in the experience. I hope you all do as well. Taking a step back, behavioral health, important. 23% of adults have some mental health diagnosis during the course of their lives. Extremely common. 5.5% experience a more serious mental illness at some point. This impacts our physical health. We're less likely to use proactive health-seeking behaviors, screenings, et cetera. Those go down. Cardiovascular events go up. There's lots of connection between our mental health and our physical health. And obviously, if we think about the affordability and how we're trying to be good stewards of resources. If we can get people mental health care that they need, that actually reduces overall healthcare costs. And we'll talk about that a little bit more. Next slide. And I want to just kind of ground us all when we talk about mental health care delivery. There's a continuum of care that we think of in care delivery, ranging from the mental health services that we integrate in primary care, both primary care providers, but also the adjacent mental health services, to freestanding specialty mental health outpatient care. In fact, that's the majority of mental health care is in freestanding specialty outpatient mental health care. Then there's intermediate levels of care, people who attend a partial hospitalization. They might sleep at home, but come to the hospital 5 days a week for 6 hours a day and have specialized programming. Residential care, where people live in a program that they're a part of, more common in substance use disorder treatment, but we also have residential care for other mental illnesses. And then finally, there's emergency departments and the most intensive locked inpatient hospital care. I see patients at Regents Hospital on one of our units. And that's the kind of traditional mental health continuum. But if you can just, I'll say advance because there's animation on this slide. So if you advance, the next part will appear. If we think before we're even on that care continuum, all of us have mental health, whether or not we're in any kind of treatment, and many of us are. All of us have mental health, and we can think about how do we build our resilience? How do we build our ability to cope with what life throws us and be increasingly mentally well? Our connections to other people, our sense of our diet, our exercise, our social connections, our joy in life, the purpose and meaning, all of the things that make for our mental health are relevant here as well. And then keep animating. This kind of care system that we think about, where HealthPartners has all of these parts of the care system, we interdigitate with so many other parts of what I consider the mental health ecosystem. So the counties, all 87 counties have programs for case management in the counties. All the health plans have case managers as well to support members or people in the community with complex needs. Assertive community treatment programs where people may go to someone's home. Group homes and the group home system, our state hospital system we interdigitate with, the legal system, mobile crisis teams, our community agencies. We have fabulous community agencies in Minnesota that are doing such good work that we partner with every day. Self-help groups. Some people are in AA or other peer recovery and never access a traditional mental health service and get phenomenally good care. Our schools are an important source of mental health care delivery, and our peers. And wrapping around that mental health ecosystem, next animation, are the things that really disproportionately fuel mental health needs. We know that when people are food insecure or socially isolated or have struggled with transportation or have housing insecurity, all of those social drivers can really precipitate and perpetuate mental health symptoms, sometimes mental health crises. And so it's that whole picture we think about when we think about how do you really improve the mental health of the community. And that's actually why we want to start with Marna talking about the importance of how we are in community as at HealthPartners and thinking about our relationships. So go ahead, Marna.
Go ahead to the next slide. Thank you, Dr. Palmer. As Brian teed up really well, that role that HealthPartners has in community is really part of our mission, in addition to the excellent care and coverage that we provide. So when we think about that, there's a lot of important work going on that on the surface, you might say, what does that have to do with mental health and well-being? Well, it has to do with mental health and well-being when we think about the life cycle and we think about, for example, teens engaging in a program such as the Teen Leadership Council, or we think about early brain development through our work with a program called Little Moments Count and connections between caregivers and young infants in those first 1,000 days. It looks like supporting families of young children with help with physical activity and healthy eating and emotional connection between families. Again, all of that builds that resiliency and builds those early habits and perspectives that help support mental health across the life cycle. In addition, one of our key community initiatives is Make It Okay, which I'll tell you a little bit more about. I do want to comment that all of this work is supported by HealthPartners. It's also one of our key partnership relationships with our foundations. So we're so grateful to have them helping supplement what we can do in community so we can do it deeper and have greater impact. Next slide. And really, this is about our role in working with community partners, alongside community partners, to increase the connection that people have to care, of course, and also to each other and to various kinds of support. And so these partnerships are building both physical and mental well-being. And I'm going to zoom in on the next slide here on Make It Okay. Make It Okay is an initiative and campaign that HealthPartners launched with NAMI Minnesota more than a decade ago. And it's been very important to be raising awareness around mental health and mental illnesses by reducing stigma, making those conversations more informed through people understanding that mental health conditions are health conditions, and also equipping people with language and resources and perspective so that they and we can all show up in more caring and compassionate and helpful ways in our community. That is really so that we can have people get the care and support they need and deserve. The campaign includes 3 primary sets of resources and information. There's a robust website. You can see that on the slide at makeitokay.org. And what we do is, through learning, we empower others and equip others to learn more about mental health and well-being, learn more about how to connect people to the care and the support and resources they need. We also equip people to help speak with compassion and knowledgeably about mental health and mental health conditions with others. And we ask them to go spread the message. So it's a robust campaign, and I hope you'll take time after this to learn more about it. But on the next slide, I just want to zoom in on an important point, that this is all because mental health is health. And go ahead and advance. Mental health is something we all experience. It matters every day for all of us. And our mental health shapes how we think, how we feel, how we act. So all of this work around mental health isn't only for people who carry a diagnosis or live with a diagnosis of a mental health condition. It's for all of us. And so the work of Make It Okay, the work that's happening in care, is really designed to support all of that continuum. The next slide emphasizes what sounds like something simple, and yet we've found over the years in our research and monitoring of stigma levels that the words we use to talk about mental health, mental illnesses, mental health care, they really matter. On the positive, caring, compassionate language helps people feel more understood. They feel less judged, safer talking and sharing about their mental health. And then that last bullet, really important. When people feel supported and the stigma is reduced, people are more likely to seek and connect with the care they need and deserve to have the best life and full life possible. On the next slide, it's a really important caveat here, is that we know that different groups of people, different identities, different cultural groups have different experiences around mental health and well-being. The stigma may sound, look, and feel different depending on whether you're a man or a woman, depending on your age, depending on your beliefs from a faith community or your values from living. There and culture and community, particularly in communities of color. There's a disadvantage there in terms of access to care, but there's also a disadvantage in terms of the level of stigma that people experience. As we think about Make It Okay, there are resources and perspectives from all of these different ways people identify, and it's a great step to understand more and learn more about that, because everyone deserves to support their mental health, and everyone deserves access to care where they feel safe and heard and understood. On the next slide, it was important that we talk about how different people and different identities experience mental health. And there's also general tips and general ways that we can approach this topic. There's a whole list here, but what we often say in community is as we do this work, we focus on helping people understand that mental health conditions are just another kind of health condition. So if people are unsure how to support or how to talk with someone about it, think about talking with a person the way you would talk about diabetes, should they wish to talk with you about that, or another health condition. Those are less stigmatized conditions in many cases. And so Make It Okay really strives to help reduce that stigma so we're all as comfortable talking about a mental health condition like bipolar disorder, depression, as we would be about diabetes or heart disease. On my last slide, before I hand it back to Brian, I think this is the other really important point. We talked about stigma and helping people feel welcomed, heard, and included in the conversation around their mental health. And when we're talking about accessing to care, really there is no one door to get that care, nor is there one right door. We talked a little bit about trust in communities. And so depending on a person's identity or their life experience, they may, for example, have more or less trust in their primary care provider. They might say, yep, I can tell that provider about this and have them help me get connected to care. Maybe it's a holistic or cultural healing practice. Maybe it's a faith community. Maybe it's a person's employee assistance program or through their health insurance, that they pick their health insurance card and they make that call. The point is we want to be sure that people understand there's so many ways to access care so that when they are ready and when they need that help, that they can get it quickly in a way that feels safe and trusted for them. I'm going to pause there and turn it over to Dr. Palmer. I don't know if you want to comment any more on this before the next slide, Brian.
We can talk about it. I love Make It Okay. I'm just such a big fan because it's just such a great training. If those of you on the call, you can go through a training and learn a ton. It helps you with things like how do you talk about this stuff? So like instead of she's bipolar or he's schizophrenic or he's aschizophrenic, like no, it's a person with schizophrenia, whatever, which seems obvious, except for a lot of us, it's not. Or I caught myself yesterday saying something was crazy. Like, okay, what I mean is it was surprising to me, that like that's more accurate and a better term. The language starts to shift. And when we think of how, because all of us want to be supportive, but we don't always know how. So it gives you a nice path forward of how you support yourself and your family and all those people around it. It's a great program, but thanks for the tour of Make It Okay and the good work you're doing, Marna. Should we go to the next slide? So I told you I see patients at Regents Hospital, and I think of myself first and foremost as a psychiatrist and a clinician, but I also have a role at HealthPartners where I lead the mental health for our health plan. So we have health insurance, and we're thinking about how do we serve our members. And when I am out with our employer groups who purchase our insurance, when I'm internally talking about mental health, I remind everyone that when people get the mental health care they need, other stuff also improves. We see a reduction in ER visits. We see people take their meds for their hypertension and for their cholesterol. All of those other things get better. Preventive care improves. COPD improves. Heart disease improves. In fact, And from a financial perspective, mental health care really just about pays for itself. My favorite study of this was in JAMA. When people got the care they needed, study of 200,000 people, when they got the care they needed, their overall healthcare costs went down by a lot, actually, by about $115 per member per month or per person per month, which in healthcare dollars is actually a large amount. And that was continued over 15 months. It was $97 over the following 12 months. It really showed that when we can get people the care they need, everything else improves. And it's sort of obvious, but for a long time, I don't think that was the way we thought in healthcare. It was kind of this thing off to the side. And I think we're starting to get to an era where we're really thinking constantly about how do we integrate mental health in the healthcare system. Next slide. So what we've done at HealthPartners, we have a network. We have a large network. For mental health, we have grown aggressively. We've added, since 2022, 2,186 individual contracts with practices, which brings us up to a total of 5,937 different locations in our network that you can seek care. Some of you are aware we partner with Cigna to use their national network. They've doubled their national network, which has been great. But we know that's not always easy because sometimes you'll try to call someone, and if it's a single shingle person, they may be a fabulous therapist, but they may not have a website, they may not have online scheduling. So we now have new partnerships with groups like Headway and Grow Therapy at the bottom of the slide that allow a person to join and use their platform, and they can see patients on their platform, which does allow online scheduling and billing and measurement of care, completion of surveys, et cetera, which we think, so we can say now confidently that if you're a HealthPartners member, you have access to mental health care next day, which is something 4 years ago, we were talking about 35-day wait lists. So we have worked really hard to make sure that there's access. Next slide. And as we've done that, what we've seen, this is actual data from the approximately 900,000 people who have medical benefits through our commercial insurance. When we look at that group, we've seen that the percent of our spend that's going for outpatient services has gone up over the last 4 years, and the percent of our spend for inpatient services has gone down, which is exactly what you'd want. Like, that means people are getting care more upstream, we call it, or earlier in their course, and they're less likely to end up at a hospital or an emergency department with more severe symptoms. That's great. That shows that we're getting better access than we had before. Next slide. Now, 2.0 on that is access into what? And I'm really interested in how we help people get the care they need for their particular mental health needs. So take obsessive compulsive disorder. Common disorder, often undetected, underdiagnosed, and it really requires some specialty treatments because people get intrusive thoughts that they can cause considerable anxiety with associated behaviors. And when they have that, learning to lean into that anxiety is hard to do. So it requires specialized therapists that know what they're doing to help with that. So we've partnered with a national group called NoCD that all they do is treat OCD. And they're great. You may have seen Howie Mandel as their spokesperson on TV. They're advertising, but that's available to our members. Or Equip for eating disorders. We have fabulous eating disorder treatment through Melrose. Not everyone can get to Melrose, and not everyone wants to come to a residential program or something like that. If you can have care in your home, especially for an eating disorder, how great. Around meal times, et cetera, the family dynamics, all of that stuff becomes easier to address. Pelago for substance use disorders, chronic pain, Lynn Health. We've had some new partnerships to make sure our members can get better access to specialty care, not just general mental health access, but to specialty care that can help them. For people with chronic pain, please consider getting mental health help. It is awful to go through life with pain, and people can develop a relationship with their pain, and all they think about is their knee, and they filter everything through their knee. And sometimes the mental health part can really help you get a handle on it, and they can actually helps the pain improve in weird ways, even though that's not the goal. So it's really an awesome opportunity. Next slide. In the care group, our direct care system, we've developed a program where in primary care or OBGYN, we're able to refer essentially same day into what we call a behavioral health consultant. And that person meets with a member, meets with a patient, and can help them with whatever the mental health issue they have that day is. Rather than waiting for weeks, we just do that the same day. The average is actually 4 days to schedule because most people don't have the ability to just say, oh, sure, I'll do another appointment on the same day. But we actually have the ability to do that if they wanted it the same day. So 40% are scheduled the same day or next day, 4 days on average. What that does is have a focus session. So it lets our clinicians see more patients because they're seeing them for fewer visits. And the average person, surprising to us, 76% are able to get their needs met within 1 or 2 or 3 sessions. And it is incredibly helpful sometimes just to focus on, here's my crisis, here's what I need help with, and let's solve that problem together. I think sometimes there's a perceived barrier that if I'm going to go to therapy, it needs to be for once a week for the rest of my life or something like that. And I love therapy. There are people who benefit from longer term therapy, but there are a lot of people who can really benefit from this kind of short term focus. So that's been a terrific intervention, and 16,000 of our patients have been served in that way. Next slide. Running in the background, we have all these cool things happening. So we've got digital programs that are available. But one thing that's kind of interesting that you would never guess, that as an insurance company, we do this. When people have claims for certain medications, that triggers messages about how to take the medication safely, the condition that's being treated, et cetera, so we can help people understand their condition. We have an algorithm running that was developed with our HealthPartners Institute that detects rising suicide risk. When we see that, we're able to assign a case manager and reach out to that member who may be headed into a crisis, and we're able to detect that before they may be fully aware that they're in a crisis based on our algorithms. And we're doing that, again, in the background, just to try to support our members and make sure they're well cared for. And then next slide. And we have more to do. I think Marna talks some about the Make It Okay campaign, and candidly, COVID reduced a lot of stigma for a lot of us. There were a lot of us that had mental health symptoms that we weren't used to having during that time. And the end result of that was actually people got more care, and it reduced stigma, and people felt more comfortable talking about their own mental health and the mental health of others. That was especially true for white women. And it's less true for men and for people of color. And we know that, and we have work to do, and we are doing that work. And it's important at HealthPartners that we're serving everyone in our community. And I'd say also for substance use disorder, we're not there yet. That the idea that I am having an evolving relationship with the substance, that I'm using more than I had intended, that I'm using despite consequences, there's a lot of shame and hiding. And oftentimes people wait until it's really bad, and then they have a DUI, they flip their car, there's something bad, and then they're going to go off to residential treatment. There's a whole opportunity before it gets bad to help people with substance use disorder, and we have resources available, and we want to help. And I think that's an area where we all have work to do as we continue to lower stigma and increase access. So Marna, you had some more thoughts on what else we can do and what we individually can do.
Yeah, thank you for that overview. So many things that you said, Brian. I hope that people notice just when you can hear Dr. Palmer and all of us talk about mental health, how it isn't with stigma or shame or any judgment at all. It's a health condition. And whenever, Brian, you talk about it, that comes through so strongly. And that's really the model. How can we all show up in a way that helps people access care earlier without the shame or discomfort, whether that's for substance use disorder or substance use, or whether that's around mental health? I think the other piece here, that idea about getting care early is critical. And on the next slide, there really are many ways that each of us can take an active role in helping support mental health for all. And one of them is, we've called out really exploring the resources that Make It Okay has available. Again, that's for everyone. It's community facing. We actually have people engaging from all over the country and actually, frankly, all over the world, really interested in how to learn more about having those conversations, learning the words that come naturally to us for other kinds of health conditions, and avoiding that shaming and stigmatizing language. We have online, there's a pledge you can take to join the effort. You can follow us on various social media just to stay informed. But I think the point is, Brian mentioned this earlier, there are opportunities for you to learn more, whether that's on a virtual format. We have routine offerings about Make It Okay. You can find those right on the website. Listen in for an hour where we dive more into how to talk about these factors, how to engage with others, and how to think about caring for your own mental health. This really isn't just about others or people in our life. It's also about each of us feeling empowered and finding resources that help us support our mental health, whether we live with or don't live with a diagnosed mental health condition. So there's some learning there. You can also become what we call an ambassador. We basically equip you with tools and resources that you can go out and share with community. And then just connecting with community. When we all show up and talk openly and without stigma and shame around mental health, it catches on. As we talked about during COVID, we did see reductions in stigma for some groups of people. We may not have seen more informed conversations around mental health, however. And so this is another way to get informed and to for your own self and for those you care and love. The other point here, and I know we'll talk more about this, is we just want to thank the community for all the support that lets us do this work through our foundations. And there are opportunities to be involved by donating and giving to this kind of community work, especially in times where we can see how important access to mental health care is. And we can do so much as a healthcare system, and we rely on bringing the community along with us to prevent those delays in care. Brian, anything else you'd add on those last steps or next steps for people on this call today?
Yeah, okay, I'll end this way. When I was in residency, I was talking with a supervisor about this work, and he ended with a phrase that was really helpful to me and has stuck with me for 25 years. That doing this work makes us more forgiving of ourselves. And I think about that a lot. And I think as all of us kind of embrace like mental health, you do sort of ease up a little on yourself. Like we're all works in progress. We're doing the best we can. And that's how people who are in the field think about you. And if you can extend a little bit of that grace to yourself, usually that's a helpful thing.
That's about the best summary I could have thought of. Thanks for sharing that, Brian.
Sure.
We are prepared to answer questions, but we'll turn it back over to our moderators today to facilitate that. Thank you all so much for being here.
Well, thank you, Marna and Dr. Palmer. I would like to also introduce Pete McNabb through the foundation's program manager at Park Nicolet Foundation, who has more information to share. But yes, this is a great time to think of your questions that you want to put into the Q&A, and we'll try to answer whatever we can. Thank you.
Hi, folks. Pete here. Thanks for the introduction, Joe. And thank you so much to Marna and Dr. Palmer for your fabulous presentation on the mental health, behavioral health services at HealthPartners as a whole. I think just before I touch briefly on our philanthropic impact, it was so great to hear not only more about our community approach, but also the plan side of the equation and all the effort that has been made to creating more access for our members, As an employee, I am one. And so it just is super comforting to hear the lengths that have been gone to make sure these services are available to us. So without further ado, I'll get into the impact. We can advance 2 slides. The first area I want to talk about briefly is the work that's been done and the generosity of the donors in the Amory region to make better therapeutic spaces at the behavioral health clinic at Amory. So we heard a lot about access today, and access is important both virtually and in person. And so the fact that the behavioral health clinic at Amory exists and persists is super important from a rural access perspective. And I think that the clinical spaces we have at all our health partners care areas do typify an attitude and attention towards making spaces nice, making them calming, inviting, therapeutic, healing. And the donors at Amory have taken a special interest in this and have made lots of gifts to the behavioral health clinic in Amory to make it such that they can create and kind of customize a space that really does facilitate healing and efficacy within the mental health treatments and interventions that are offered to patients there. So really cool story. Hope to see more of that in all of our mental health clinics. We can advance once more. And again, so the Daybridge partial hospitalization program is something that is available, or it was started at the Regions Hospital. We heard from Dr. Palmer earlier about the care continuum, and partial hospitalization is a really important part of that care continuum. It's something that has been augmented through philanthropy and philanthropic support. And it really fits into kind of our larger system emphasis on value-based care. Partial hospitalization at Daybridge allows patients who have a certain degree of need to get that need met without having to receive additional care that they might not need, and to leave inpatient settings open for those persons who are in need of that, right? So like Dr. Palmer described, partial hospitalization is like a modality wherein our patients are seen in person 4 or 5 days a week for 6 hours at a time, where they receive mental health and behavioral health care, including traditional talk therapies and medication assistance, but also music and integrative therapies and other holistic methods to meet patients where they're at. And then they are also able to leave and to go home and to kind of carry on with other aspects of their life in addition to receiving care. A great kind of success story with this also is that we've been able to extend Daybridge now from the east where it started on the St. Paul side to the West Metro over in St. Louis Park. So there's now a Daybridge clinic at the 3800 building, I believe, where patients from the West Metro, some of whom were commuting to Regions for this care that they were not able to receive from their providers on their side of the river. We've now been able to support that through some gifts to the foundation to make that care available here in the West Metro. And there's even plans and a desire to kind of enlarge our capacity and to create an environment where we can serve more patients than the cohort that are currently being met over in St. Louis Park. So hopefully we'll have more updates for you on that in the future. And then we can go to one last slide. I'll try and be really brief in advance again. We heard Marna talk a lot about Make It Okay. I just want to emphasize that this is a partnership with the foundation. Our donors do support Make It Okay. And the thing that's important, and I want to emphasize here before I turn it over, is just that wherever you are in the Health Partner system, whatever region you're in, wherever your clinics are, whatever your hospital is, Make It Okay is a program that spreads beyond all those boundaries, right? This is something that is truly ubiquitous to our system. It's something that we all support and we all benefit from. So if you're wondering how you can be involved or how you can make a difference, wherever it is, Make It Okay is an answer, a possible answer to that question, and we're really proud to support it, the family foundations as a whole, and we look forward to deepening and strengthening that partnership in the future so that more ambassadors, more pledges, and more people can be reached. But anyways, that's all from me. Thanks so much for your time, and I'll pass it back to Joe.
Thank you once again, Marna and Dr. Palmer and Pete. Thank you all so much. If there are questions, I'm looking at the Q&A. If there are any questions that you have that you would like to be able to discuss, we do have a few minutes to be able to bring questions forward for Marna or Dr. Palmer or for Pete, or I suppose for Joe or me also. But okay, I think I do see something in our chat. Okay. First question that I have here. I often hear that the wait times for mental health care are very long. I didn't know about how HealthPartners has expanded access. How can I spread the word?
Spread the word. I mean, I think it is a message. We get stuck in narratives. Like, I think we tell ourselves it's impossible to get into mental health or whatever. And that candidly was true. I mean, when in 2022, when people were really struggling, we did not have easy access. And so it's 2026. I'm not saying it's perfect, but you don't see stories of kids boarding in EDs the way you did 4 years ago. You're not seeing the wait times that you were seeing. Things are quite a bit better. And if you ever need help, if you're a HealthPartners member, do call that number on the back of your card. There's a behavioral health navigator that's especially trained just for mental health. That's all they do is help people navigate the mental health system. They can help you use your benefits and understand what's available to you. And anything I talked about today would be available that way as well. So yeah, please share that we've made a lot of progress, and it's been a lot of hard work to get there, but we're making progress.
I would add to what Brian said to remember that idea about multiple doors as well, that there are many ways to access care that may not be fully utilized. I'll give one example. It is for people who are employed and have an employee assistance program. These can be another route to care that's frankly not very well utilized, and usually very low cost or low barrier or don't charge at all. So those are messages, again, to add to that narrative that Dr. Palmer talked about, that we want people to know there's multiple ways to access care that can reduce those wait times in addition to the work we're doing as a healthcare system.
Thank you. One more question that's in the chat here. Mental illness is a family illness, much like many other illnesses. Could you speak to the availability of group support for families and friends of those living with mental illness?
Yeah, I love that question. And I think it's true. There are some basic things you can learn that can be really helpful when you have a family member that has a mental health condition. So we refer to NAMI. I probably make a referral to NAMI 5 days a week when I'm seeing patients. It's great for family members to learn some basic skills, et cetera. If you have a loved one with a serious mental illness, especially, it can really help. And also help with the stress of that, how you're coping yourself, et cetera, and find other parents, often parents that are in the same boat. A little plug, my clinical specialty is in borderline personality disorder, which is another serious mental illness that's often quite stigmatized. People have chaotic relationships, may self-injure, cut themselves, et cetera. And those family members really can struggle. That's a difficult experience to go through as a family member. The National Education Alliance on Borderline Personality Disorder, NEA BPD, I've been on their board and facilitated the family workshops that they have. Their Family Connections program is free. It's available and really high quality for that particular subgroup, if that's a group that you're affected by. But it's, yeah, getting support for yourself is just, we should all be doing it.
I'm going to jump in for just a second. You've mentioned NAMI a couple of times. Can you spell that out and tell people how to get more information about NAMI?
thanks, National Alliance for Mental Illness, NAMI. Minnesota has one of the best NAMI chapters in the nation. It's really it's a great organization with educational courses, free events you can attend, etc. They do advocacy work. It's a terrific partner. We partner very closely with NAMI. I was on a call yesterday with NAMI.
Thank you.
And to make it easy, I did just put the web link to their homepage for NAMI Minnesota in the chat for those who can see it. And the support groups and programs that Dr. Palmer mentioned don't even need a referral. These are places where anyone can go and access, and they're rich resources and super helpful for families and individuals.
Looks like we have one more question in the chat here I want to be sure to get to. I see that some of the vendors we use, like NoCD, are owned by venture capital funds. Since they are about maximizing profit, to which I don't object, how do we monitor that they are not shaving services over time?
Yeah, when we choose our partners that we're going to bring into our network, we have a very extensive vetting process, and we went through that process. We have quarterly updates from these vendor partners that we work with to look at clinical outcomes, and we want to make sure that our members are getting the best possible care. I will say, oftentimes the profit motive encourages some better care because they get better outcomes and they're able to show to plans because they want to be paid a little bit more. So the incentives are often aligned in the correct direction. I appreciate that I am part of a nonprofit for a reason. Mental health in Minnesota is generally a nonprofit enterprise, and I think it should be. But that with appropriate monitoring, I think there's a role for some of the for-profit groups that have a lot more incentive to innovate, and that is the advantage that they bring. So we partner carefully.
Those are all the questions that I see at this time in the chat. And I want to make a quick plug for every 3 years, we do a community health needs assessment. And in our Amory Hospital and Clinic service areas, we have 7 facilities from Amory up to Luck, Turtle Lake, Clear Lake. And mental health, or the need to improve mental health, has been the #1 need on that community health needs assessment every year that we've done that. So I appreciate everything that you are doing, Marna and Dr. Palmer, and truly appreciate all the outreach that is possible and all of the care. Maybe one more question if we have time here. It just came in. How can members be referred to programs such as LIN or the other MI specific programs that were listed that seem appropriate if they may not be able to access a program locally?
Yeah, I call the number in the back of your card and you'll talk to one of our behavioral health navigators. The simplest. You can go to the websites, etc., but you're not going to remember each program name I gave you. But if you describe what you're looking for help with, that'd be the simplest way to get matched.
Thank you all so much for your presenting today. Thank you everyone who has joined us today for this really important topic. And may you have a wonderful day. Please do also keep an eye out in your inbox, because the recording of today's session will be made available to you and emailed out to you in the next, I think in the next few days. So please do keep an eye on your mailbox. And again, thank you so much for joining us today.
Thank you, everyone.